Dr. Isaac Sobel is the Chief Medical Officer in Nunavut. In addition to making annual trips, heading up free medical clinics for the poor in Tibet, he's focused his medical career on Aboriginal health. He's worked with Métis and First Nations, and now Inuit communities.
I think there has been a big perception, public perception about vaccines, and I think it's paradoxical because it's really due to the success of vaccines that we've seen this change in public perception. Now that we don't see people getting polio and meningitis and measles and mumps and rubella, people don't recognize that in Canada, hundreds of kids used to get sick and be hospitalized every year, and people would die every year from these illnesses. So nobody sees the bad stuff, and they forget why vaccines were put in place in the first place. When I was young, my father was a doctor, and I grew up in that household, so vaccines were just something that you had to get. I remember being scared stiff, and my own father would give me the vaccine. I remember running, screaming around the house, not wanting to get the needle. So my initial reaction was, don't hurt me, don't give me that stuff. I had no idea why it was being given. But as I got older, I never resisted vaccines. I got them anytime they were due. I've done a lot of traveling, so I've gone to public health facilities and I've made sure that my vaccines were always up to date. In my family, we've never had a problem with acceptance of vaccines. As I said, I grew up in a medical family, and vaccines were just accepted. I'm an older person, so I remember when polio vaccine first came on the market. There didn't used to be polio vaccine, and people in Canada should remember that, for example, Neil Young. Everybody's heard of Neil Young. He had polio when he was a kid. You know, he didn't get the vaccine, and he was affected by polio, and polio affected thousands of people. My own mother got polio. She was crippled for her entire life, and for our family that meant we never went on hikes, we never went camping, we never engaged in sports activities as a total family. So personally, I've experienced the negative effects of an important close family member who actually had the illness that a vaccine can now prevent. You know, I've seen firsthand the disastrous effects of an illness which can be totally prevented by a vaccine. So absolutely, I have no hesitation recommending the vaccines to anyone and everyone. I think that, you know, we're so lucky in Canada. The vaccines that we offer are free to everyone. They're widely available. All the nurses who give them are well trained. It's safe, it's effective. We should be counting our blessings that we have the opportunity to get protected against these illnesses. We have really good distribution systems. We have really good procedures for getting vaccines into each and every community. I know that I've heard in some Aboriginal communities there's a concern that primary care isn't easily available, and so the access to a vaccine program may be a challenge. But in Nunavut, that's definitely not the case. No matter where you live in this territory, we've got a really good primary care facility, and we've got the vaccines available in each and every community. If someone, a young adult or an older adult, hasn't had a vaccine for quite a while and they wonder what they might need to get, what is recommended for their age group, I'd recommend that they go to their local community health center and talk to the nurse in charge who would know that information, or if they're in Iqaluit, in our capital, they could go to the public health building and speak to the communicable disease control nurses. For the general public, I think there are really good websites. The Public Health Agency of Canada has a really good website, and they talk about immunizations, and I would recommend that people go to that website and take a look. It's really important for people to recognize that when they get vaccinated, it's not just for their own health. It's for the health of their family, and it's for the health of their community. Because the more people who get vaccinated, the less chance there is of anybody in the community getting sick with the illness the vaccine prevents. We call this herd immunity. It's a term in public health that we use. And actually we gave that message out quite frequently during the H1N1 outbreak in Nunavut. We were hit really hard at the beginning of that outbreak. And we were constantly saying to people, you should get the H1N1 vaccine, not just for yourself, but for your loved ones, your family members, and your entire community. Because the more people who get the vaccine, the less chance there is that we'll keep experiencing illness and death from H1N1. And we saw that happen. Within 2 weeks, 62% of our population got vaccinated against H1N1. And when most of Canada had a second wave that was worse than the first wave of H1N1, we never got a second wave. We've only seen 34 cases of that infection since the end of September. Tremendous success. So this is a great example of how an effective vaccine program can keep a whole community and a whole jurisdiction healthy.
Sharon Ungnakuk lives and works in Iqaluit. She's raising a healthy young daughter, Maria, and has worked closely with the local hospital to keep her vaccinated. Sharon has stayed educated about vaccination programs in her area and has made sure Maria has had everything she needs to grow up healthy.
I think that we live in an area of the world where we're more prone to certain diseases like tuberculosis and things like that. So I think in that sense it is important. I did choose to get my daughter immunized with the tuberculosis immunization. And just because her age and entering into daycare and being in close proximity with people that might have the disease, I think it is important. When I had my daughter vaccinated, I found that it was very painful for her to get it done, big needles and just a scary place, things like that. But the nurses were very helpful. They gave us some medication to help with the pain, like some acetaminophen and stuff like that, which they gave to us free of charge. So that was great. And they notified us if anything happens within a certain amount of hours to bring her in, and they had us stay in the clinic for about an hour after she had the shot, just to make sure everything was safe and everything was good. So my experiences have been, pretty good. I think that they've done their job very well, and Maria's, a very healthy kid, so I think that has something to do with it.
Archie and Pat understand the importance of keeping their loved ones healthy, and their practices of receiving vaccinations have been passed down to Sharon and her daughter.
We do have a friend that had polio, that's been affected by polio from, I guess, the early 50s. I think it just reinforces the need to keep up with your vaccinations, and that I think we're just very thankful that we have such things that can prevent those kind of diseases happening today.
I think community perception up here of vaccination has really changed. Because they've seen the benefit of what it can do to you and for the entire community as well. And we have families up here who have lost loved ones to either polio or to other diseases, preventable diseases. If we had the vaccinations up here, they would have lived. I encourage other fellow Canadians to take advantage of vaccination programs that are available at their communities, because in the long run you will benefit from it. I myself getting vaccination, like the tetanus shot or something like that, the nurse kept on to me, look, it's been 15, I think it's every 10-15 years that you take that. So this nurse was on to me on my case the whole week. I said, okay, I'll come and get the vaccination. And I did, and Lord and behold, the following day I was dealing with old wood, and that was full of old rusty old nails, and guess what happened? I stepped on a rusty old nail. And that's the whole point of that vaccination, is to prevent rust and dirt, and when it gets into your skin, that it doesn't escalate to something major. It was just a superficial wound. And if I didn't have the vaccine, it would have been a lot more serious. And that's what it does.
I'm Adam Beach, and this video was brought to you by the National Aboriginal Health Organization.